Good evening from Rocky Mountain PBS. I'm Cynthia Hessin. This is Colorado State of Mind. Tonight, the latest Colorado Health Report Card, measuring how this state stacks up against other states in the health of residents here, as well as health care access and coverage. We'll talk about the details tonight with representatives of the two organizations which collaborate on this annual assessment, Michele of the Colorado Health Institute and Shepard Nevel from the Colorado Health Foundation. And also with us two other health policy experts, Tracy Faigin Boyle from LiveWell Colorado and Dawn Morris of Mental Health America of Colorado. First, here's a look at those overall grades for 2012, starting with the youngest demographic, babies, which is Healthy Beginnings, where the grade is a C, putting Colorado in the middle of the pack relative to other states. In the category Healthy Children, the latest grade is D+, down from a C- in 2011, and ranking Colorado 31st of the 50 states for children. The overall health of Colorado's adolescent population is up slightly for 2012 to a B compared to a B- in 2011. Healthy Adults shows a B+, so Colorado is 13th in the nation on that. And for older adults, Healthy Aging, the grade is also B+, up from a B last year, and there Colorado is 10th in the nation with better results than 40 other states. So, Michele, tell us first how these grades are determined. What kind of data do you use?
Right. Well, we use a number of different data sets that we compile together each year to come up with the report card. Those are national data sets because we want to have the ability to compare how Colorado does to other states. And so we look at information from the American Community Survey. We look at information from the Center for Disease Control. We look at a survey called affectionately known as the BRFIS, which stands for the Behavioral Risk Factor Survey System, so it's much easier to say BRFIS. And those all are compiled. There are 38 indicators overall, and we categorize those by life stage to come up with our grades.
So what are some of those 38 indicators?
Oh, they range from looking at indicators about how much access people have, and so are they insured and do they have appropriate access to care, to things like eating fruits and vegetables and do we have appropriate food sources or nutritional food sources for those kids. Dental visits are included, obesity rates, and then a lot of lifestyle measures like substance abuse, alcohol consumption, tobacco use, and the like. We want to get a really comprehensive picture of how we're doing as a state on the report card.
Tracy, LiveWell Colorado was established 4 years ago to attack the obesity problem. And what's interesting is that Colorado is still number one, meaning we have the fewest obese people, but we're gaining, in the wrong direction, right?
Correct. While we are number one for adults, 58% of our population is overweight or obese. And we're not number one for children in the obesity ranking. We're 23rd. And we have the second fastest rising rate of childhood obesity in the nation. So that's where you're seeing some of these lower grades for the kids, because it really is very concerning that our future Coloradoans are not going to be at a healthy weight if they're already 1/4 of them are overweight or obese as children. And we've doubled the obesity rate in the last 16, 17 years. For adults. So, so we are really rapidly gaining in our obesity levels.
Yeah. And if this were X number of years ago, this ranking would not put us number one in the nation.
Correct. So right now, our obesity rate for adults is just over 20%. We used to be the only state below 20%. We are not anymore. So at the 20% rate, if you went back in time to 1995, we would have been the most obese state. So just in that time frame, it goes to show you how rapidly not only Colorado but the entire country, the obesity rates have increased.
Shepard, why is that? Why have we become such a fat nation?
Well, it's a great question. And when you look at Colorado, and as Tracy mentioned, we do have this paradox that we have healthier adults and less healthy children, particularly as it relates to the obesity rate. It correlates very closely, I think, to the childhood poverty rate, which has increased over the last 10 years at the second highest rate in the country. So there's a lot of social determinants that contribute to the obesity rate. I would flip that around, though, also and say, and look forward to talking about what we think are some of the active solutions that we can build on and expand and to really level off the obesity rate and to reduce it. And that's one of the, I think, focus areas of our report and the companion document, is to really acknowledge the problem and to see where we have some real challenges, but also to say we can get to number one in all of these categories, and this is how we think we can get there.
That is interesting. The first time that this report has tried to project what it would be like if the state were number one in all of these categories. Before we come back, though, to solutions, I want to bring Don Morris into it to talk about mental health. I was amazed at one of these statistics in here that says that to employers, mental illness is 4 times the cost of medical illness when you're talking about the employee population.
Yeah, it is amazing the cost of not addressing mental health issues. And we're not talking about just deep issues like schizophrenia or bipolar. We're talking about, anxiety disorders, panic attack, the kind of thing that a lot of people face every day. And it definitely impacts productivity at work. It impacts the bottom line for employers, not just in how much more they pay for health insurance, which I think increases at $2,000 a year for employers, but in this lack of productivity of employees. If they could just get a handle on good mental health, it would be better for the employer's bottom line, as well as, of course, for the person. This is part of that cost then is sick days? Right, it's sick days, but it's also just not working as productively at your desk. It's if you think about it, if you are undergoing some tremendous stress in your life, could be a child had an issue or something else, you're distracted, you're facing some serious issues that keep you from, performing as well as you could. So it is also that lack of ability to perform at your highest level. All right, I was talking to someone about this yesterday when I was looking through the material, and of course there's that sort of jokey thing people do where they take a mental health day. Is this self-reported information? I mean, would that figure into it? It does figure into it, and so we look at absenteeism and we look at self-reported information, and to Don's point, we have some indicators where we ask if people feel blue. It's not like we're not asking if you have schizophrenia, we ask if you have a couple days a month where you feel down or blue or depressed. Cynthia, this is the first year that we've really tried to quantify in a variety of different ways these issues of lack of productivity and absenteeism. And we tried to look at that in a couple of different ways, not only days and hours lost on the job, but also in terms of the economic impact. And according to the estimate that we've published in the supplement, is that Colorado, as a state, we're spending $121 million unnecessarily on, it's necessary now, but it potentially could not be necessary if we got to a level of mental health that was like the best state in the country. And that's $120 million annually is a significant number, and we've done that across a number of different measures to be able to quantify this in some meaningful way. That $120 million would be seen at the individual level, the family level, the company level, and the state level. And so we've tried to quantify that, and I think that's a really interesting part of the report card this year. It wouldn't have been reflected in this year's report card, but coming soon are some new crisis centers in Colorado that people have heard about. These would be 24/7 places that people could stop into if they needed to, or you could take someone there. What kind of effect do you anticipate that can have? Well, it's a huge initiative that we've got to give Governor Hickenlooper pats on the back for putting on the table. And the legislature, they have actually even upped the dollar figure. Now it's to $19 million for all of these measures. What this is a combination of a center and a call-in line, which we actually have in the Denver metro area right now, Metro Crisis Services, but expanding that statewide. And if you think about it, people who are in crisis or think they're in crisis, right now in the metro area, we can pick up the phone and call Metro Crisis Services. You get a 24/7 professional to answer that call. If you think about all the people in this state who would have someone to call, and then if needed, somewhere to go, a crisis center, it would have an amazing impact both on the health of the person facing the challenge and their family, but also on the systems, whether it's the jail system, whether it's the emergency rooms, where that's the place they go now, and then they'll get better treatment, what they really need. It'll have a tremendous positive impact if we can push that initiative over the finish line at the legislature.
Let's go back to obesity, because this is something that can be tackled. How is that being done in various Colorado communities, Tracy?
There's definitely not one singular approach that's going to solve this problem. It's taken 25 plus years to create, and it'll take quite a while to reverse. We need to come at it. We like to come at it what we call a supply and demand approach. So we really have to make sure there are opportunities for people to be active and access healthy food in their communities. So in their schools, in their communities, in their work sites, and really talking about changing a culture as well, where the healthy choice is the easy choice, it's the affordable choice, and it's the popular choice, really. And if you think about our society today, that's not really the case if you look at what's offered at a lot of schools, if you look at what's out on the table at work sites, if you look just at what's on the street corner in terms of offerings and what's affordable. It's really not the healthy choice. And so we really need to change our systems, our economies, our business culture, everything about that to create more opportunities to be healthy. We're doing a lot of work in schools. It does start with our young people. Everything from changing the way we serve healthy food in the cafeteria by training nutrition directors and employee cafeterias to create food from scratch, to getting better to create communities where kids can walk and bike to school, to get that activity, to passing policies where elementary schools now require approximately 30 minutes a day so kids can get physical activity in the school day. All of these things are really systems-based to create that long-term change.
I think LiveWell's doing a great job in terms of really thinking about not only health in all policies, but this idea that you mentioned about where the default option is the healthy option, and how infrequently we do that, where fries come with the meal but the salad doesn't come with the meal, or that the default is that you walk to school and not take the bus to school. And we can think creatively, perhaps not at the Bloomberg level of thinking creatively about sodas and the like, but I think that there are ways that we can really sort of think about the default as being the healthy option, and I think LiveWell's doing a great job.
How many of these things, like mentioning about communities where kids can bike and walk to school, that's not an easy thing to change in some urban areas?
No, it is. It's a good question. It is challenging. But if you look at the three areas where obesity happens and where you can solve obesity, if you look at the home, if you look at the school environment, you look at the community, there are some very practical strategies to make healthy food more accessible. So you promote produce and grocery stores that serve healthy foods. And in the schools, as Tracy was saying, an enormously rich opportunity there, because so many calories are expended and consumed there. There are opportunities, and then with parent education and support through strategies so that parents of all incomes can provide healthier food to their kids, and make sure, again, that the community has recreational opportunities, safe places for people to walk and exercise. As Tracy said, you put these multiple strategies together, and you can move the needle in childhood obesity, and that's really what we're focused on, I think, individually as an organization and as a collective group of organizations in the public and private sector in Colorado. And there's so many positive examples of how this has been done in other areas as well. Michele has spoken in other venues about how the campaign against tobacco and cigarette smoking, which reduced cigarette smoking by more than half, is a good blueprint for what we can do with regard to healthy eating and active living and obesity reduction. It took many years, so do you expect it to take so long with obesity?
Yeah, I think Tracy mentioned that it's a decades-long investment, and that's sometimes frequently it butts up against the political will kinds of issues. Yeah.
Well, let me mention on the addressing the mental health side.
Yeah.
we're thrilled to be at this table in a larger way, in a more meaningful way, because it's been difficult to get people to even talk about mental health issues. So, number one, kudos to everyone at this conversation that we're talking about it, and to society for starting to be more open to talk about it, because we almost have to get to a certain starting line to really address these issues, that some of these issues don't have to face, and that includes the stigma and some of the challenges in that regard. So I'm just really excited that we're talking about this, and thank the Health Foundation for including it in its report card.
I do think the stigma of addressing mental health issues for individuals has become less than it was, but is it still a major obstacle to people getting help?
I believe it is absolutely still a big challenge. Better than it was, unquestionably, but still quite the hurdle. People still have such hesitation to talk about it. And I think one way you get people to talk about it is employers can be much more open about, the mental health days and making it more routine that they address that issue. So ways to address it, but it's still there.
And on the subject of obesity, one of the reasons this is such a major concern is that the associated diseases that go often with obesity, diabetes being the chief one. Hit us with some numbers. How much are we losing?
So when we look at, as Tracy mentioned, if we went back in time, if we were number one in adult obesity right now, and I think that if we went back in time to 1996, we again calculated what that savings would be, and on an annual basis, the state of Colorado would benefit. We realize a cost savings about $240 million annually, even if we were able to reverse that trend and go back in time, which is awfully hard to do. It would probably take that amount of time to reverse it, but we need to do it in a variety of different ways. Childhood obesity, if we became the first state, if we had a rate that was like the best state in the country, we would again save $40 million annually. So this is our attempt to really quantify as well as qualify the problem within the state.
The report talks about what if we were number one. And so one of the numbers that jumps out is that there would be 92,000 fewer adults with mental health difficulties. That's huge.
It's huge. It's as big as a lot of cities in our state of people who wouldn't have those challenges. If we were addressing our issues in a better way, and we're the number one in this country, there would be close to 100,000 people who wouldn't have these challenges. And we're in the top 10 in suicide in this country, number 6, and it's very sad. We would undoubtedly impact that number, and in that way push ourselves down maybe off of the top 10 list. That's not somewhere we want to be. Right. So absolutely, the way they've quantified it to say where would we be if we were number one is really some nice numbers and some great goals.
What are some of the other numbers? There would be many fewer teen pregnancies?
Well, that is, and Don touched on it, one of the things we wanted to do was really to focus on these specific goals, and some of them are very tough. And some of them are a little smaller in number. So if we were to increase by 2,100, for instance, the number of healthy births, we would be number one in that category in the country. If we were to increase by 23,400, the number of children that had access to a medical home, so continuous, comprehensive, coordinated health care, we would be number one in the country. So we're not going to be able to reach all of them immediately, but it does help, I think, if you will, to have a roadmap and to say, here's a number to aspire toward, and what can we do as a state to enable ourselves to do that. And we have a lot of really high-performing organizations, we've mentioned a few of them already, that if we were to help build and expand on their capacity and then identify the gaps and if there are additional services that need to be provided, to provide them. And as Tracy said, to make some politically achievable policy changes as well. You put all those ingredients together and we can really advance the health of all Coloradans and get as close to one in as many of these categories as possible.
It seems like some of the things you're mentioning, healthier school, lunch choices, more exercise, of course, these are things that we've known about. Is it a matter of simply changing the culture? Not simply. That's kind of not simple. But you talk about making the healthy choice the one that is easier and most cost effective. Can you do that in restaurants and other places? How do you achieve that?
Well, you're right. It's not a simple solution. I think it's a matter of creating a culture change where people demand healthier choices. So I think you do go into restaurants now, and I think you do see some healthier choices.
Oh, yes.
Even in restaurants and fast food places where you wouldn't have seen that even a year or two ago. And the reason they're doing that is they are reacting to public demand. It's an economic, simple calculation for them. Same thing goes with schools. Every school, down to the individual building, has its own culture. And in some schools, it's very acceptable to bring cupcakes on every birthday, every test day, reward with candy, things like that. In other schools where there's health and wellness policies in place at the school level, or they're being implemented from the district down to the school level, you don't see that, and parents wouldn't even think to bring that. And there's a lot of just controversy around that as well. So there really has to be more discussion about not just policy at the state level, but how do we culturally create health in all the places where our kids spend time, in our communities and in our homes, even in our work sites. Are we putting out donuts or are we putting out fruit in the morning? So we need to take it down to that level of giving people healthy choices, and that the healthy choices it's not a punishment, it's actually quite pleasant and quite enjoyable.
And I would add to that much of this is within our reach. And Jim Hill from the Anschutz Health and Wellness Center, right here in the Denver area, has talked about the energy balance. So that if we were children or adults to increase a little bit of physical activity and decrease a little bit of caloric consumption, so skip a soda, walk an extra 10 or 20 minutes a day, that we could, bring the obesity rate, level it off, and then start to bring it down. So these things are possible to do and to incorporate in people's lives. And so what we're really focused on is eliminating the obstacles to doing that. And we have to be very mindful that, particularly in underserved communities, there's considerable obstacles to being able to accomplish that. And also maybe with a little bit of a nudge here and there with policy or other incentives to provide some positive motivation for folks to do that as well.
Michele, was there anything in the numbers this year that surprised you or that took a big jump one direction or the other?
So no, it does not do that, and part of it is we're often asked that question about why don't we see greater fluctuations in the grades, and the reason that we continue to be sort of in this middling area has to do with that these are changes that we hope to see over long periods of time, and we hope to see improvements over a long period of time. These particularly public health indicators are very hard to change because they do require these sort of cultural changes. They require a different sort of thinking about mental health and the stigma, and changing that takes time and generations to do. And so we focused really on looking at the elements that sort of go into the grade. To use the report card analogy, so we take a look at the quizzes and the book reports that sort of go into the overall grade on the report card. And there I think we have some opportunity for improvement, particularly our uninsured rates and our poverty rates. And those are more sensitive to policy decisions that we can make. And so we can start with the pop quizzes and the book reports and work up to the entire grade.
In a few minutes that we have left, the economic impact of this is what the report comes down to in the conclusion, not only the improvement it would make for individuals, obviously, but what it means for the state. Can you tell us a little bit more about that?
Yeah, so we looked at as Don mentioned, so many of us receive health insurance and thereby access to health insurance through our employers. And so we really looked at how and why and when should employers be concerned about the health of our state. And so it may be what's the connection between teen birth rates and in the employer environment, and what's that connection like? And so we've tried to make that very explicit this year by looking not only at both like the lives and the quality of lives that could be impacted, as well as the cost. And so we started with a really simple idea, a simple calculation. If we behaved more like the #1 state, we would have fewer people who were obese, or fewer people drinking, or fewer births in really high risk situations. And we multiplied that by a per capita, and we came up with these costs, the economic analysis of it.
And on mental health, Don, you've mentioned the cost to employers. What would you project out in the year, or 2 or 3 years?
Well, first, it's brilliant to put it in these terms, because then you're capturing the attention of a real important constituency that should be paying attention to this. And it allows people in the mental and behavioral health community, the drug and alcohol community, to really look at talking to employers in a different way about these issues, not just about the health of their employee, but a bottom line. So we find the numbers they've put out to be so helpful to us.
And obese children, that's the future workforce. Mm-hmm. That's something, that's a big reason to be concerned about it.
Absolutely. Obesity in adults and children. And in the same for the same exact reason, once employers really understand the impact, the health, the absenteeism, the production, lack of production, it's devastating to our economy. And if we can turn that around by creating change at the workplace and in our state, it will have a huge impact on our economy.
Last word, Shepard Nevel, what does the Colorado Health Foundation hope to accomplish with these annual reports?
We hope to inform the public policy discussion and to really catalyze action in some of the areas where there's already a lot of good things going on, but maybe we can do it a little more intensively with a little more focus, and to help make Colorado what we're absolutely confident it can become, which is truly become the healthiest state in the nation, which is good for the health of our residents and also really important to our economy.
Thank you, and that is our program for this weekend. You may see it again online if you'd like at video.rmpbs.org. Thank you now to Michele and Shepard Nevel, and also to Tracy Faigin Boyle and Don Morris. Next week, another big issue drawing intense interest at the state capitol, and that is, should Colorado abolish the death penalty? We'll be talking about it with 2 legislators who have introduced competing bills, as well as a researcher who has looked at the cost and results of Colorado's capital punishment law over the years. Thank you for joining us tonight for Colorado's State of Mind. I'm Cynthia Hessin.
You know, in the same way that smoking on an airplane was and then became not acceptable, and smoking in a restaurant was and became not acceptable, there could be, I think there is a growing awareness of what is healthy for you and what isn't.